Hey, welcome. Welcome. I'm Dr. Otto Janke, and this is the weekly webinar. It is May 6th. Holy guacamole. I was talking with a patient today about cancer. We're going to dive deep and quickly into this. So I was talking to her about cancer, and she stated that last year there was a shadow seen on a chest x-ray, a mammogram. So she asked, what could she do about that? The true answer is they really had no option for her except for to start some kind of radiation or chemotherapy. Interesting. Statistics are about 1 in 3 of us, 1 in 5 of us are going to have, between cardiovascular disease and cancer, 20%, 1 in 5 people are going to have cancer. A little over that, almost 1 in 4 are going to have heart disease. So the question is, how is our healthcare system done with that? Do you remember the war on cancer that Nixon started? Yeah, I know. We look at what President Nixon wanted to do against the war on cancer as I state here, as I bring it up. By the late 60s and early 70s, cancer had become the second leading cause of death in the United States behind heart disease, as it is now. Nothing's changed there. Inspired by successes like the moon landing, influenced by advocates such as philanthropist Mary Lasker, Nixon framed the fight against cancer as a focused Apollo-style national crusade. In his January 1971 State of the Union address, Nixon called for a, quote, concentrated effort, and, quote, comparable to splitting the atom or going to the moon to conquer cancer. Going to the moon to conquer cancer. He followed up with a May 1971 message proposing an intensified cancer cure program. A cancer cure program. What's interesting about that is it did. On December 23rd, 1971, Nixon signed the National Cancer Act of 1971 into law in a White House ceremony, often described as a Christmas present to the nation. The act amended the Public Health Service Act to strengthen the National Cancer Institute, giving it greater autonomy. Its director and budget proposals reportedly more directly to the president and Congress, bypassing some layers of review. It established the President's Cancer Panel, expanded research centers, supported international data sharing, and created a national cancer program. The goal was ambitious: to find causes, improve prevention and diagnosis, and ultimately cure cancer. Initial proposal in early 1971, Nixon requested an additional $100 million above the existing NCI, National Cancer Institute budget, which is around $232 million at the time, to launch the intensified effort with a promise to seek more as needed. The National Cancer Act authorization, the legislation authorized roughly $1.6 billion over 3 years. This represented a significant ramp up from prior levels. The act marked the start of a sustained growth in federal cancer research funding, which rose dramatically in subsequent years. Well, let me ask you a question. How are we doing against that now? Cancer deaths to over 600,000 in 2019, 2020, 21, 2022 you can throw out because of COVID, but still the numbers went up. 2023, 613,000, 2024, 620,000. How have we done? No, really. How have we done? And I asked this patient, so what'd you do? And the first thing she did was she read this book called Anti-Cancer, A New Way of Life by David Servan-Schreiber. I read this quite some time ago. It came out in 2007, 2008. So 18 years old. That book, I read it when it first came out. I asked her if she knew about the studies that were done by Dean Ornish, Ornish. Ornish took men who had been biopsy diagnosed with prostate cancer. He wanted to see if they could have a shift in what they do and see what that would happen with the prostate cancer. What I find very, very amazing about this is that I'm going to show you the title of the article. Intensive lifestyle changes may affect the progression of prostate cancer. First of all, if it's intensive lifestyle changes, do you want to do it? No, I don't want to do intensive lifestyle changes. Why do I have to do that? What's very, very interesting about this is that the lifestyle changes weren't all that intensive. They went to more of a fat-free diet, dramatically plant-based. They exercised, had mental rest and focus like we talk about all the time. They meditated. They saw a counselor. The only thing they didn't do is get adjusted so that their nervous system was optimized. None of the experimental group of patients, but 6 control patients underwent conventional treatment due to an increase in PSA and or progress of disease and magnetic MRI. PSA decreased 4% in the experimental group, but increased 6% in the control group. So, as medicine would say, that's a 10% decrease. And the growth of the LNCAP, the cell growth of the prostate, was inhibited almost 8 times more by serum, as they detected it, from the experimental than the control groups, 70 versus 9%. These lifestyle changes, these significant changes were associated with the degree of change in diet and lifestyle. So they took these men, they put them through a program, and they saw them get dramatically better. Well, you can say, oh, it's a 4%. Well, the other group got worse. This group got better without radiation, surgeries, or androgen deprivation therapy. Then the owner said, let's go see what that does against cardiovascular disease. Reversing heart disease with the Ornish program. What did they do with them? Same parameters. Same parameters. The owner's diet is a vegetarian diet, so we'll be focusing a lot more on fruits, veggies, legumes, and whole grains, while cutting out meat, poultry, and fish, and limiting dietary fat, sodium, and cholesterol. This might seem daunting, but there are lots of ways to be creative on the owner's guidelines, and more importantly, you won't have a heart attack. Or like the other patient that was in my office today, who's now on 5 meds. Couple of blood pressure, couple of cholesterol. So Ornish showed that they could reverse cardiovascular disease with the same parameters. So now we have cancer, and now we have initiated cancer, and now we have cardiovascular disease, the number 2 and number 1 killer of Americans. And then Ornish said, let's see what that does against early stage Alzheimer's. Yeah, I know. A groundbreaking 2024 study led by Dr. Dean Ornish suggests that intensive lifestyle changes, I don't think it's really that intense, including a plant-based diet, okay, daily exercise, okay. By the way, they aren't running 20 miles a day. They're doing yoga. I'm not saying yoga isn't necessarily strenuous, but it's not as if they were pumping iron for 2.5 hours a day or running 20 miles. They weren't. Stress reduction and social support may help stabilize or even reverse early stage Alzheimer's. Over 40 weeks, 46% of the participants improved cognitive function. And another 37.5% showed no decline. So between the two, you're looking at what, 83% of the people either got better or didn't get worse or stayed the same. The amazing part about it, and I've read this study a number of times in a number of different places, they state that participants who fully embraced the regimen saw the greatest benefit. That means if you dove into it and said, this is what I'm going to do, they had great benefits. They got better benefits. Can I ask you a question? Well, they also say this. Unlike drug treatments, these interventions carry no harmful side effects and may reduce Alzheimer's markers in the blood. Yes, larger scale studies are needed. Here's a great question, though. He's shown by doing this style of living, you can decrease the number 1 killer of Americans. You can decrease the number 2 killer of Americans. And you can decrease a terrible, terrible disease, Alzheimer's. At what time were any of these ever given to either one of those patients? At what time? At what time were the lifestyle changes? When were those opportunities, guidelines, recommendations given to those patients? Instead of saying, you might want to walk more. What the fuck is that? You might want to. Here's the amazing thing about insurance programs. When it comes to my practice of chiropractic, they always want to know, they always want to have a ramp on and a ramp off. When's the patient going to ramp onto you? And what's the plan to ramp them off your care? What's the ramp down or the ramp off for patients with high blood pressure or high cholesterol? Yeah, there is none. For the patients who are on statins, do you know how much statins actually increased your life? You know how much statins increase your life? How long they increase your life? The study is that it's 3.2 days. Go look it up. 3.2 days. Take a statin for decades. You have all the side effects along with that, but you're going to get 3.2 days more. How many times has a doctor said, by the way, you need to, I'd highly recommend you go to a vegetarian diet. You exercise daily. You do this. You follow the Ornish protocol. Matter of fact, I'd recommend that you take your insurance monies and go to some place who has the Ornish protocols and put your insurance monies toward that. How many times does that happen? It doesn't. Why? And please don't give me that bullshit answer if there's no money in having people getting healthy, then change your game. Then change your game. The number of times I've heard somebody say to me that, well, you know, there's no money in people getting healthier. They hear it from their docs. Well, then that doc needs to change their game. They need to change what they're doing. If it's been shown in 3 different devastating disease processes that by doing this change, you can significantly decrease this, and this. Wouldn't that be something you want to be looking into? So I'm the longevity guy. And why do I talk about this? Because if you want to be around for more better years, then you got to prepare to be around for more better years. Then we have to dramatically decrease the number 1, the number 2, and number 3 killer of Americans. We have to dramatically decrease. Almost 1.5 million people a year dying from these diseases. Yeah, I know. I'm the longevity guy. Why is he talking about that? Shouldn't he talk about take that nutrient, nutrient? No. What do those things matter if you are not moving, not eating correctly, not sleeping correctly? Those things don't matter. If we want you to be around for longer, then we need to decrease the opportunity. We need to help you to be so healthy that those things don't take step in you. The basis of longevity is very, very simple. If we want to be around for more better years, we need to get you to be so healthy that the cardiovascular disease, the cancers, and the dementia don't stand a chance against you. Build you so strong that they don't stand a chance. That's longevity. The repeated attitude of our healthcare system says, let's prevent this, prevent that. We still have women preventing breast cancer while they're still dying astronomical numbers from cardiovascular disease. What's the overall gain? There isn't one. How can we help you to be so healthy? You have so many more great years. That's the key. We already know what our lifestyle in America leads to. We already know that. How do we know? Look at the numbers. They talk about intensive lifestyle changes. They're not. As compared to cancer, as compared to a heart attack, as compared to Alzheimer's. They're a day in the park, man. If you need help, questions about that, let me know. Do this for yourself. Ornish, Ornish. Look up the studies. You'll be amazed. And then you'll get pissed. I'm Dr. Otto Janke. We'll see you next time.